All right. So here's the first question. And I'll give you some time to solve this. Let's say 30 seconds. All right, so you're all skating around it, but I did get one correct answer. So let's look at this tablet.
So it's
Somebody says, "What is this?"
tablet.
Yeah, you can score it in quarters. It's a quarter scored tablet. So first we find the doctor's order. The doctor says administer or prepare a dose. I start with my order, 800 milligrams. I put that over my imaginary one because you know how I am. And what am I solving for? Well, I'm going to give a tablet. So you know me, I'm keeping it same. So how do I get rid of milligrams and get to tablets? Well, I use what's in my problem and I have 360 milligrams in a scored tablet. You still with me?
Yep.
Well, crossing off my milligrams and I have my tablet. So now I do my math. So 800 times 1 is 800 and 360 times 1 is 360. I divide 360 and 800 into 800, I'm sorry. And it should give me what? 2.22222. All right, so now you have a decision to make. I can split this into quarters. So is 2.22 closer to what? 2 or 2.25 or 3? See what I'm saying? Where are we going? So what are you going to give this patient?
2.25.
Yes, you're going to bring that patient in a nice fancy medicine cup, 2 whole tablets, and then a quarter of a tablet, because you can break it off into a quarter. Make sense now? Just needed a little refresher. All right, now what's this one? This one's just a little bit different. This one's scored differently. So solve for this one. So we're going to use the doctor's order, the given, prepare 0.25 milligrams, and I'm solving for a tablet. That's what I'm going to bring my patient. And the pharmacy delivers a tablet that's 0.1 milligrams in a tablet. And the tablet is scored, and I can score it in half. So now it's math. So when we do the math, it is literally 2.5 tablets. So you will bring the patient 2 whole tablets and then a half a tablet. 2.5 tablets. Boom! I love it. All right. Now, let's get into some nitty gritty. Yes, somebody had a question?
Yes, I have a question. The first question, so it was a scored tablet. What if it was scored in 2 halves? The answer would be different?
Yes,
Because
if this was a half tablet, you mean? If
yeah.
this one was a half? Yeah, so if this one came down to a half, but your answer came out to 2.22, right? And you can only give, so if you have a tablet, you can score only in half. Is the 0.22 closer to 2
Yeah.
or 2.5? So which one is it?
2.
2. Yeah, you would have to give 2 tablets.
Okay.
Yep.
So pay attention to what it's scored to. Okay.
That's it.
So Professor K, I have a question.
Yeah.
So will it always give you a picture, whether it's scored in quarters or scored in halves?
Here, I'll give you a photo. In
Okay.
practice or in an exam for a job, they may hand you a bucket of tablets, but in practice, you're gonna have the pill in front of you. You know what I mean?
Okay.
You
Yeah.
have the
Because
medicine.
I just because for the last question I got 2.2 repeating and I
Yeah.
put 2.2. Oh, no, I'm sorry, I put 2 as the answer. Sorry.
Right.
Tabs. But you
But
know, there was no if there wasn't any visual, then there's no indication whether it was scored in 4s
Yeah.
or
No, you're
you know
right.
what
If
I'm
it
trying to
doesn't
say?
tell you, it's scored, then it's not scored. You know what I mean? If
Yeah.
it's a scored tablet, it will tell you it's a scored tablet, or you'll have a picture of the scored tablet.
Okay.
No more questions from you.
All right, thank you.
Okay. All right. Let's keep cruising. All right. Here's your first question. I want you to read it and set it up. I'm going to pause it. I'm going to give you a minute. All right, so we're looking at our thing, we're looking for that given, and that's our doctor's order, and he's like, hey, prepare 20 units per kilogram an hour. That's a 3-factor. Let's do it. 20 units over kilogram per hour. And it's going through an IV infusion that's running continuously. The patient weighs 66 kilograms, and the med is available in a 10,000 units in a 250 milliliter bag of D5W. And right away I see the word pump, but it's also telling me and asking me what my wanted is. They want to know milliliters an hour. So I start with that given, which in this case is my 3-factor, and I know what my wanted is, milliliters an hour. So boom, I have hour. I'm feeling good about myself. I'm ready to celebrate. How do I get rid of kilogram?
You put 66 on top.
That's right. I'm going to use what I got, 66 kilograms. Fabulous. I get rid of kilogram. Great. Now, all I need is to get rid of units and get to milliliter. So I look at my problem. I've already used this. I know I'm solving for this. The only thing left is how it's delivered. So it's 10,000 units in 250 milliliters. I cross off units and I'm left with milliliters, and now it's just math. Where did you go wrong, Natalia?
I didn't round it.
Ah!
I
what it
know,
is.
it's always the
So
little
20,
things that get
it's always
me.
something, right?
Yep.
20 times 66 times 250 is 330,000. Put that over 10,000, because 10,000 times 1 is 10,000. And when I divide, it will give me a beautiful, crisp 33 milliliters an hour. And that's what I'm going to set my IV pump to run at. Beautiful. So don't forget the basics. Get your given, know where your wanted is, and then make that path to it. Let's try this one. I'll give you a minute to solve. All right, let's solve. Let's do this. So I'm reading it. I'm always evaluating. I'm not jumping to conclusions. I got to read my doctor's orders.
Where I put the answers in the chat? I'm like so blind.
You just
Where's
click chat. All right. So look for that order. The nurse is going to prepare a medication ordered at 5 milligrams a minute. All right. So that's my given. 5 milligrams a minute. And it's going through an IV. It's available in 2 grams and 250 milliliters. Fabulous. And it's normal saline, even better. We love it. So we're using an IV pump, and they need to know how many milliliters an hour. So these questions are telling you what you're solving for. But if it wasn't telling you, it says IV pump. So you know you're solving for milliliters an hour. So I have where I'm beginning and I know where I'm going. So, I like to cross off what I've used. So now, how do I get minutes changed to hour? I think 1 hour is 60 minutes. That's the first part. Good. I got rid of minutes and I got hours. That's exactly what I needed. Fabulous. Somebody got bumped out. All right. Then how do I get milligrams to milliliters? Well, what's left in my problem that I haven't used? It's only this 2 grams and 250. So I have milligrams and it comes in grams. So I got to know my conversion. So what is it? 1 gram is 1,000 milligrams. That gets rid of my milligrams. Now, how do I get rid of my grams? I go to my problem. 2 grams in 250 milliliters. Gets rid of my grams, and I have milliliters in the numerator position right when I need it. So I'm good. That's where I'm supposed to be. So now it's just math. 5 times 1 times 250 times 60 is 75,000. And 1,000 times 2 is 2,000. And when I divide that into it, I will get 37.5. My rounding rules are what? Anything greater than 10, I round to the whole number. So I look to the right, 5 and up, I round up. So my answer is I will set my IV pump to 38 milliliters an hour. Beautiful.
Professor,
Yes.
I have the sheet with a round, and it seems like I'm always, like that's a little struggle that I always leave that little last part, which is going to cost me points. I always forget the round.
Only going to cost you 1, but guess what? It's on the direction. It's on the page of your test.
Yeah. So it's going to be there, right?
Oh, yeah.
Okay. I thought maybe it's the last semester, so they're going to
No. No. Well, maybe that's a good idea. No. We'll give you the, yeah, it should be on your direction page. No problem. Let's do another. I'll give you a minute to solve. So you guys know this. It's just, you got to brush up. You're just nervous. It's high stakes. I totally get it. Absolutely. So let's read the order. We always got to read what we got going on in our questions. The nurse is going to prepare and give a med that's ordered 4 micrograms per minute. Available is 1,500 micrograms and 150. You're going to use an IV pump. So right away, you know it's milliliters an hour if you're doing an infusion. So I start with my order or my given. And here's another tip for you. If you know what you're solving for, milliliters an hour, and you are struggling with where do I start? Well, if you're looking at like hour is in the denominator, look for something that has time in it. It's another way to keep you focused. If I need to solve for hour in the denominator, look for something with time in the denominator. So here we go. We're going to set up a problem. I use 40 micrograms. I know what I'm solving for in milliliters an hour. Now it's just a process of eliminating what I don't need. So I can start with my micrograms. I have 150 milliliters in 15,000 micrograms. Cross off my micrograms. I have milliliters on top. Now I have to change minute to hour. So 60 minutes is 1 hour. Beautiful. No tricks up my sleeve. That's pretty much it. And now it's just math. Please be careful with your math. If you're done early, recheck your math and your transcription. So when we multiply across the top, it's 360,000 and then 15,000 across the bottom. And when I divide that into each other, it is 24 milliliters an hour I'm setting on my IV pump. Beautiful. Here's another. Go for it. You're looking at this problem and you're doing an infusion rate through a pump. You're looking at strength over time, but you're solving for volume over time. So my given is 2 milligrams a minute. I'm solving for milliliters an hour. And even if it didn't say that, you're using a pump. So we know it's milliliters an hour. So it's just a matter of eliminating what you don't need. I don't need minutes. So I'm going to say 60 minutes is 1 hour. There's my hour. And now I have to get 2 milligrams to milliliters. And I only have this left of my problem. So I have to convert milligrams to grams. So 1 milligram, 1 gram is 1,000 milligrams. And then I'm going to say 1 gram in 250 milliliters. Cross off my grams, cross off my milligrams, and now it's just math. So when we multiply across the top, it's 30,000. Multiply across the bottom, it's 1,000. And when I divide, it is 30 milliliters an hour. Good. All right, here's another type of problem I want you to solve. I know a lot of you have confusion around 2 of these types of problems, so I'm going to give you a minute with this one. All right, so let's do this one. Oh, there you go, Nesco, you got it. See? So here's the problem that we're looking at. So when you're looking at this question, what is the given? Well, the given is the doctor's order. He ordered 50 milligrams per kilogram per day. That's a 3-factor. It's going to be given every 8 hours in equal doses. The patient's weight, how the med is supplied, and it's asking you to solve for milliliters. So it's telling you what the wanted is. So we start with our given. It's 50 milligrams per kilogram per day. The order is 50 milligrams per kilogram for the entire day, for an entire 24 hours. And he's saying we're going to divide it though in every 8-hour doses. I'm solving for milliliters. So you see everything I have to eliminate just to get to milliliters. So it's just a matter of what you want to get rid of first. So let's get rid of milligrams first. How can I get rid of milligrams? I'm going to use what's in my problem, 200 milligrams in 2 milliliters. Beautiful. It crosses off my milligrams and I have my milliliters. Great. I used it. Let's get rid of kilogram. 1 kilogram is 2.2 pounds. Great. Got rid of kilograms. Why am I using that? Because the patient's weight is in pounds. So now I have 40 pounds and I put that over 1. I got rid of pounds. Excellent. So now I just have to get rid of the word day. This is when you know that you're supposed to use how many doses are in a day. When you have a 3-factor and the word day is in the given. So every day, how many doses is the patient getting? Well, in this case, if he's getting every 8-hour equal doses, how many is he getting in a day? Right, 3 doses. 8 times 3 is 24. So 3 doses every day. This crosses off the word day, and that's how we get with the dose, the word dose. So we were solving for a dose in the denominator. And that's where people usually get mixed up, and I'm going to show you the difference in the next question. So when we do the math across the top, the answers across the numerator are 4,000, and across
Sorry.
that's okay. And across the bottom is 1320. When I divide, it'll give me 3.03. When I round, the answer is 3 milliliters. Why is it 3 milliliters and not 3.0? Because, oh, you're supposed to go to the tenths, and this doesn't round up. Why do we never write it as 3.0?
So that we don't confuse it as 30.
That's exactly right. There's a rule with trailing zeros. We never do it so we don't accidentally give 30, because that's a lethal dose. So the answer is 3 milliliters. Very good. Now here's the next, this is where people get confused. Solve for this one. It doesn't say this is the dose per day.
Yeah,
This is saying this is the dose to give the patient every 12 hours.
so you don't divide it by 2.
You don't need to.
Yeah.
And that's where people get confused.
Yeah.
So solve for this one, and then we'll do the other one like we just did, another one. And so very good. So let's do it. The given is the order, and the doctor ordered 0.25 milligrams per kilogram. I'm starting there, 0.25 milligrams for every 1 kilogram of body weight of this toddler, okay? And it's telling you how many milligrams will you give per dose. So you're solving milligrams. And you can write dose if you want, but you're solving, it's asking you how many milligrams, okay? So where do I start? Well, I want to get rid of kilograms first. So the baby's weight is provided in pounds. So 1 kilogram is 2.2 pounds. And the baby weight, and that gets rid of my kilograms, and the baby weighs 20 pounds. And I put that over 1. All right, so I got rid of all of the kilograms, the pounds, and I'm left with milligrams, and that's all I needed. You see the difference between the two questions? I didn't need the every 12 hours. I didn't need, it didn't even have the word day in the problem. It didn't say this was the dose per day. It's saying this is the dose the baby will get for every 1 kilogram of weight. So we are not dividing by 2 because we don't have to. It didn't say 0.25 milligrams per kilogram for the day, because the day is 24 hours. It just said 0.25 milligrams per kilogram by mouth every 12 hours. So maybe this baby will get 0.25 milligrams at 8 a.m. and then they'll get 0.25 milligrams at 8 p.m. But now we need to know what that looks like based on the patient's weight. And that's where people get confused. So let's do the math. 0.25 times 20 is 5, and 2.2 times 1 is 2.2. When I divide that, it will give me 2.272. And then 1 to 10, I round to the tenths. I look immediately to the right of that. 5 and up, and I round up. So the answer will be a 20-pound toddler will get 2.3 milligrams. Another way of thinking about this, let's say you wanted to solve, if it says give 0.25 milligrams per kilogram, why don't you just solve what is 20 pounds in kilograms? Well, if I have a baby that's 20 pounds and I want to know how many kilograms that is, I can say 1 kilogram is 2.2 pounds. And I cross off my pounds because I'm solving for kilograms. And now 20 times 1 is 20, and 2.2 times 1 is 2.2. So now I can just solve for the weight in kilograms, and that would be 9.0909. So let's think of it this: 9.0909 times 0.25 will give me the same answer, 2.272. Does that make sense now? A little bit? Or you're probably like, no.
No, it's actually easier to do it separate, I think. kind of
Okay.
naturally.
So what's the difference? Here's the difference. Now solve this one. Right away, what's the difference in this question?
That it's every 6 hours, so we have to divide it by 4.
Because the order is written for the day, Now you have to use the divided doses every 6 hours. This one, the order was just to give this for the body weight. There was no word day in it at all. So I'll let you solve this one. All right, so I think you see the difference. So here, what is the order? It's a 3-factor. They're saying this patient should get, 5 milliequivalents per every 1 kilogram of body weight for the entire day. That's the difference. So for the whole 24 hours, this patient should receive only 5 milliequivalents. But the doctor wants us to give it in divided doses every 6 hours. Every 6 hours is how many doses? 4 doses throughout the day, because 6 times 4 is 24 hours, and there's 24 hours in a day. So now it's just a matter of subtracting what you need. You're solving for milliliters per dose. So let's get rid of the word day first. Every day, the patient's going to get 4 doses. Beautiful. Now I have dose. Let's get rid of kilograms. 1 kilogram is 2.2 pounds, and the patient weighs 62 pounds. Beautiful. I got rid of kilograms and pounds. How do I change milliequivalents to milliliters? The same way we've been changing it for 2.5 years. We're going to use the equivalent that's provided, and that is 10 milliequivalents in 12 milliliters. Boom. So now it's just math, right? So now we do the math, and when we go across the top, it's 3,720 and 88 on the bottom, and that will give me 42.27, and greater than 10 around to the whole number. So it is 42 milliliters every time you give that baby a dose. Beautiful. Got it? Yay! Let's do some cardiac meds. I'll give you a minute to solve. All right, so yeah, these are monstrous kind of equations to solve for. So let's just start with the basics. An IV med of 250 is running. It's already running at 25 milliliters an hour. We got a patient weight, and they want us to solve a 3-factor micrograms per kilogram per minute. So remember, I put what I need in my numerator and denominator. I always include it in my wanted. It helps keep me focused, keeps me honest. So where do I start? Remember what I always said, if you're solving with anything with time in it, look for that volume over time or strength over time. But this is obviously an order. The doctor's running it already, or the nurse is running it at 25 milliliters an hour. Beautiful. So I've used that. I know what I'm solving for. So it's just a matter of what you want to eliminate first. So let's do hour. Let's change hour to minute. 1 hour, 60 minutes. Beautiful. I got minutes. I need kilograms. The patient's weight is in pounds. So what do? We do nurse math. We add it anyway because we're nurses. We do what we want. So 1 kilogram is 2.2 pounds. It goes against everything we know, but that's us. We're nurses. So now how do I get rid of pounds? I'm going to use the patient's weight. 110 pounds and put a 1 on top. Beautiful. Nurse math. So now all that's left is to get rid of milliliters and get it to micrograms. But my problem has milligrams, but it does have milliliters, so I'm going to use it. 250 milligrams in 250 milliliters. Beautiful. I get rid of milliliters. Now I got to change milligrams to micrograms, and you know that all day long. 1 milligram is 1,000 micrograms. It makes the problem disgusting, but it still is a solvable problem. So when we do the math across the top, it'll be even more disgusting. It'll give you something like 55,000 over 6,600. And when I divide that into each other, I will get 8.3333. So remember, if we're using an IV pump and we're administering something like kilograms per minute, we have to be using a pump. This is the one off for the rounding rule where you would use rounding and you can use a decimal on an IV pump. And you should have seen this in all of your clinicals, unless you didn't go to the ICU yet. So the answer is 8.3 micrograms per kilogram per minute. But if you do take a hit on it and you lose a point, make sure it's only a point if you put 8 micrograms per kilogram an hour. All right, so if you are getting your exams and you want to see where your error was, certainly if you didn't pass, you better ask to sit and see that exam. And make sure that you're only losing a point for rounding errors and not 5 points for rounding errors. Okay, good. Let's keep going. Here's digging in the archive for you. Solve for this one. There's some NICU nurses out there. So let's do it. Our order is 2 milligrams a kilogram, 2-factor, 2 milligrams over a kilogram, and they're asking you to solve for milligrams. No problem. Put that over 1. So the patient weighs 4,501 grams. That little baby, that little chunker, a 4-pounder, 4.5-pounder. No problem. I got you. So you need to know the conversion for kilograms to grams. So 1 kilogram is 1,000 grams. And then I can use the baby's weight, 4,501 grams, put that over 1. And it is that easy to solve. Yay, you just have to remember the conversion. So when I do the math across the top, it's 9,002, and across the bottom, it's 1,000. And we don't want to make any errors with our little neonates, that's for sure. So when I divide 1,000 into 9,002, I will get 9.002. These are not significant. But even if they were, it would still not be enough to make it anything other than 9 milligrams. So the answer for that little baby in NICU would be 9 milligrams. That's what you would give the baby. Beautiful. Let's keep it going before it's midnight. All right. Okay. Okay. Here you go. Well, spectacular. Yeah, I had a spot check you. It's not that I don't trust you. I just want to make sure you get it. All right, so again, the doctor ordered 25 milligrams for every 1 kilogram of body weight for the entire day. So this order is saying for the entire 24 hours, this patient is only going to get 25 milligrams. But then he says, you know what? But I want you to get it every 4 hours. So that's how you know when you need to use every day. There's how many doses when they ask for the dose. Because this order is saying for the entire day, give 25 milligrams. And then he's saying, but let's divide it in equal divided doses to torture you. Yay. No problem. I got you, doctor. 25 milligrams per kilogram per day. Every day, how many doses is he getting if he's getting it every 4 hours? Every day. That's right. 6 doses. Because 6 times 4 is 24. Beautiful. So now I have the word dose because I'm solving for what? Milliliters per dose. So I got dose. I'm feeling good about myself. I can get rid of kilogram next. 1 kilogram is 2.2 pounds, the usual. And the patient weighs 75 pounds over 1. That gets rid of all my drama that I don't need. Excellent. Now I just got to get milligrams to milliliters, and we know what to do. We use what's in our problem all day. 300 milligrams in 10 milliliters. Gets rid of my milligrams. I have my milliliters, and now it's just math. Beautiful. So it's 18,750 over 3960. When I divide, that will give me 4.73. My rounding rules, any number between 1 and 10, I round to the tenths. I look to the right of that number. If it's not 5 and up, I keep it the same. So my answer is 4.7 milliliters per dose. So every 4 hours, I'm going to draw up 4.7 milliliters and give it to my patient that weighs 75 pounds. Beautiful. All right, now let's do, we just did that one. Let's do this one. I'll pause and give you a minute. I do believe you got it. All right, prepare a medication that's 600,000 units IM. They're going to get it every month. Or your problems could say every 4 weeks. That's why I added that in there. It just depends on, how the doctor writes the order. And what's available is 1.5 million units for 1 ml. How many milliliters will you give for that dose? So the order is 60,000 units. Beautiful. I have to know what I'm going to give in milliliters for that dose. You don't have to write the word dose because there's no other options in this, but I try to include the words so you get comfortable with the words because I never know how they're going to ask you on the NCLEX, and I certainly don't know how they're going to ask you when you go for jobs, but I promise you, you will be prepared. So I've used this in my problem. Beautiful. So now I got to get rid of units and get to milliliters. And the only thing I got in my problem is that conversion that's available. So it's 1.5 million units in 1 milliliter. Awesome. Cross off my units. I'm left with milliliter. Yay. So now it's just math. So you can get rid of the ugly zeros. Just be methodical. So I have 1, 2, 3, 1, 2, 3, 1, 2, 1, 2. So now it's 6 and 15. And then when I divide 15 into 6, it will give me 0.4 milliliters. Beautiful. All right. Here's another. Know this math. All right. Very good. So the doctor ordered 600 units an hour. This is probably heparin. And we know that's a powerful blood thinner, so we're not going to mess with that. We're going to get this calculation right. So we got a strength over time. It's available in 10,000 units in every 100 milliliter bag. And they want to know how many milliliters an hour. You got to put it in the pump. If it didn't say milliliters an hour, you would know. If it was a pump, you're solving for milliliters an hour because you're trying to solve for an infusion rate. So 600 units over hour, you already have your hour. Beautiful. So now how do I get rid of units and get to milliliter? Simple. I use what's in my problem. And this is literally how you would do it in the hospital. But most of the electronic health records now do the calculation for you, but I always spot check. So let's get rid of some zeros. So 1, 2, 1, 2, 1, 2, 1, 2. I'm feeling good about myself. And the answer is literally 6 milliliters an hour. Easy. Love it. Easy. Hey, let's do some insulin. All right. I think majority of you got it right. Let's look at it together. So the doctor has ordered standing insulin. He wants 12 units of N mixed with 4 units of R before meals. That's the standing order. But now he's also ordered coverage based on a finger stick. So no matter what the finger stick is, the patient is definitely getting 12 units and 4 units before the meal. But we go in and we do the finger stick at 12 o'clock. It was 300. When they order additional coverage, you have to see what the additional coverage order is for. So if his finger was 300, we look for 300 orders and it falls right here. So he's going to get 12 units mixed with 4 units. And now because his blood sugar was so high at 300, we're going to add another 4 units. So he's going to get 12 units, 4 units, and then another 4 units because his sugar was so high. So what is he getting? 20 units total because it wants to know what's the total amount of insulin. So 20 units. So be careful. A lot of you guys like to blast through these because you're like, I got this. I don't have to do anything. But then you miss the critical information. Okay, so standing orders, standing coverage, 12 units and 4 units before meals, no problem. But then he ordered coverage order for finger sticks based on the finger stick. And this patient's finger stick was 300, probably because he had a Hershey bar at bedtime. I don't know, but he did. His sugar was 300, so we're going to give him another 4 units. So 12 and 4 and 4 is a total of 20 units. Now that one is not worth losing 5 points on. Just go slow and take your time. All right, let's try another. Everybody's freaking out and breathing on each other and screaming around, and someone finally says, calm down, we got this. So the doctor says, give 0.25 milligrams IV stat, and unfortunately it doesn't come in a unit dose, and you're looking at a vial. So what are you going to do? You're going to do what you always do, 0.25 milligrams over 1. You're solving for milliliters, no problem, doctor. So I'm going to do my maths. I'm going to do my maths. When I divide 0.25 by 0.125, and all your electronic charts will have calculators, if for whatever reason you have to calculate something. And when you divide this into 0.25, oops, I mean 5. Oh my gosh, nobody corrected me. 0.5, it will give you 4 milliliters. You're going to draw that up, push it into the patient, and then we'll celebrate saving his life. Yay! We did it. All right, here's another. Go for it. Let's do it for the recording. So we're going to start with volume over time because they're asking us milligrams an hour and there's time in it. Milligrams an hour. I'm starting with the order because it's already running 10 milliliters an hour. So I already have hour. So I just got to change milliliter to milligram. I'm going to look for the label. And I got 150 milligrams in 150 milliliters. So I cross off my milliliters. I'm left with milligrams. And remember, you can cross off like numbers as well. What? And that will leave you 10 milligrams an hour. Beautiful. Let's keep it going. All right, a nurse is preparing to administer a med, 2 grams every 24 hours. So the med available is 2 grams and 0.2 normal saline. Oops, my pen just went crazy. So it's 2 grams and 250 of normal saline over 90 minutes. So there's a lot of information in this question, and it's scattered throughout the question. So you by the time you're graduating, you should know how to decipher and pick out the information you need. Ultimately, there's 2 grams in a 250 bag that's got to run over 90 minutes. So volume over time, right? So 250 milliliters over 90 minutes. But I'm giving it through a pump. So I'm solving for milliliters an hour. No problem. So how do I get there? I know how to 90 minutes, not milliliters. So I know how to change minutes to hours. So 60 minutes is 1 hour. Okay, beautiful. So I have my hour. How do I, and I have a 250 milliliters already. So I already solved. So if you were trying to use the 2 grams in every 24 hours, you got fooled. That's not what it asked you. It just asked you to solve for milliliters an hour, and that was already in your problem except for the minutes. So now it's that much of a simple math for you. So it's 15,000 over 90, and that will give you 166.66. Anything greater than 10, we round to the whole number. So I looked at the number to the right, the decimal of the whole number, and it's going to be rounded to 167 milliliters an hour. Let's do another. Oops. The dreaded drops. Come on now, what you worried about? The nurse is going to prepare to give an IV fluid at 150 milliliters an hour. The drop factor of the manual tubing is 20 drops. So let's say the pump failed. It could happen. I've seen the power go out or pump libraries break. So the answer is 50 drops a minute, because now you've got something running at 150 milliliters an hour. And let's say the pump breaks. So you look at the IV tubing and it says, yeah, it's 20 drops per milliliter. So I can do a drippity drop. So 20 drops per milliliter. I'm solving for what? Drops per minute. If I don't have a pump all day long. So I have my drops. So how do I get hour to minute? 1 hour, 60 minutes. It's that simple. And now it's just math. So 150 times 20 is 3,000, and 20, bleh. I'm sorry, I'm doing the wrong problem in my head. And then 60 times 1 is 60. And then when I divide, it'll give me 50 drops per minute. Beautiful. Do this one. Measure in your questions. We don't want any confusion. So the doctor ordered a med. It's going to be 2 milligrams. You're going to give it stat. So you're going to put it in it's in a 50 milliliter bag is what it's telling you. So it's telling you you're going to use a pump and you need to solve for milliliters an hour. So you have to figure out an infusion rate. So volume over time. So it's 50 milliliters in 20 minutes. It's basically saying there's 2 milligrams in that little tiny 50 milliliter bag, and you can run it in 20 minutes. Great. But the pump you're using is milliliters an hour. So it's a basic conversion. You already have milliliters in the numerator. Perfect. So all you have to do is change your minutes to hours. 60 minutes in 1 hour. And now it's just math. So 50 times 60 is 3,000, and 20 times 1 is 20. And when you divide that into each other, it is 150 milliliters an hour. And that's what you put in the pump. And that little piggyback, that little 50 milliliter bag will be done in 20 minutes. Beautiful. I love it. One more. Let's keep going. All right. So I found my own transcription error. Yes, it's 6.3 milliliters. So the doctor ordered 250 milligrams. That's my given. We're going to give that to the patient every 48 hours, every 2 days. I'm going to put that over 1, and it's asking us to solve for milliliters. Put that over 1. So I got to get rid of milligrams, and that's easy enough. It's right in my problem. So 80 milligrams in 2 milliliters. Beautiful. So 250 times 2 is 500, and 80 times 1 is 80, and that will give me 6.25. 1 to 10, I round to the tenths. I look to the right of that spot. 5 and up, I round out. So it will be 6.3 milliliters every time I give that dose. Let's do one more. One more for you. Now, don't you all ditch me until I finish with you. Very good. So let's do this for the recording. We're going to start with the given. It's running at 15 milliliters an hour. We're solving for milligrams an hour. No problem. So we got our hour. Fabulous. So how do we get rid of the milliliters and get to milligrams? We're going to use what's in our problem. So 150 milligrams over 150 milliliters. Cross off my milliliters. I'm left with milligrams. I can cross off the like amount, 150 and 150, and that is 15 milligrams an hour. What do you think? I mean, I'm pretty sure you're all going to ace it. What are you worried about? Take your time. I'm going to pray that Zoom recorded this and will allow me to post it on the Zoom site because I can't put it in D2L because it's too large of a file. But there is one thing I want you to do for me before you all leave me. First of all, does anybody have any questions about any of the problems? Nope. Okay, Kaisha, what's your question?
Professor, if they don't have any questions, can you just stay over for like 5 minutes afterwards?
Sure.
Okay.
Absolutely. All right, now before you guys go anywhere, I'm trying to hold on 1 second. I gotta disconnect this
Professor,
share.
I have a quick question.
Mm-hmm.
So like the package that we received,